Morning, everyone. My name is Simone Smith, and I'm a part of Cohort 39. I currently serve as the Volunteer and Outreach Community Chair for SNA. Today, I have the pleasure of interviewing Miss Latoya Bush, who served as the SNA President of Cohort 34 and was the cohort rep for the VBSN students. So I'll allow her to introduce herself.
Hi everyone, my name is Latoya Bush, like she said. Everybody calls me Toy or Toya. Yeah, I was cohort 34. It seems like so long ago, but not that long ago. But yeah, it's a pleasure to be here.
Thank you. So, throughout this interview, I'll be asking questions about her journey to becoming a nurse, the experiences that shaped her along the way, and any insight or advice she can support to support and inspire our students. Sounds good?
Yeah.
Okay. So, the first question is, what inspired you to become a nurse, and why did you choose the CVPCU?
So what inspired me a long, long time ago, my mom was diagnosed with cancer, and seeing everything that she went through and seeing the way that the nurses took care of her, I wanted to emulate that. I was pre-med, and you couldn't tell me I wasn't going to be a doctor until I shadowed some. And the life work balance didn't align with what I wanted to do, so chose nursing instead and haven't looked back.
I love it. That's really good to hear. And how did your experience at our school prepare you well for being a nurse?
Um, First and foremost, introducing me to the environment in which I would be working. That was the biggest thing. Most of my clinicals were at MedStar, Washington Hospital Center, and being in that space, I just got comfortable with the environment. And so that early exposure definitely helped. Another thing that helped was just the professors being real with us, letting us know, like, this is what you'll expect. This is what we have to do for class, but this is what you should expect in real life. So that played a huge role into adapting.
Yeah. So we know that you were a W-2 scholar as well. So how did that influence your path and opportunities?
A lot of my classmates struggled finding a job. And being a W-2 scholar, I didn't have that problem. My issue was what unit I'm going to choose. And where others were like, people were applying for months and months on end and not getting any response. I had my job before I even graduated.
That's really good. That's a blessing for sure. So let's talk a little bit more about the CVPCU. So what does a typical shift look like for you, and what was your journey to becoming that type of nurse?
So just for everybody out there, CVPCU is the cardiovascular surgical step down. PCU standing for Progressive Care Unit. Typical day it depends on if it's day or night shift, but day shift, on my unit, we are all about recovery. So first things first, get everybody's meds out the way. Make sure everybody is up. Let me start there. Make sure everybody is up in the chair, because we know sitting up, mobilizing is one of the biggest steps to progression. And then also one thing that we're big on is mobilizing the patients, and they get minimum 4 walks a day.
Very good.
And so by like 8, 9 a.m., they need to be up for their first walk. Our patient ratio is 1 to 5, which is intimidating. But once you kind of get a handle on what needs to be done, like what your why is, then the how kind of comes easier.
Oh, that's good. So what are some important skills needed to succeed in that setting?
Time management. And I know throughout school they all say like time management is gonna be your friend, but they meant that. And I kind of took it for granted a little bit, because I'm like, oh no, that big of a deal until I was in it.
That's right.
And let me tell you, having 5 patients, even when it's 3 patients, having to get all the meds, especially if you have 3 diabetic patients, getting their insulin before their breakfast is here, making sure that you get their morning meds before 10 a.m. or by 10 a.m. and then the walks, and then all the diagnostic tests and stuff that they have to go to, and transfers and admissions, discharge. Like there's a lot. And so if you're not on top of it, you can lose your focus, and it'll go really quick. So for me, I use a timeline. I write everything I can down, and that's one of the first things I do in the morning. I'm not a big fan of coming in and working off the clock. Some people are. For sure. That's not me, but that all goes into the time management. Once I'm on the clock, I'm on the clock. So that means I need to make my timeline. I need to make sure I know who my patients are and what they have going on, and know what the plan for the day is, and be able to communicate that to my patients as well.
Thank you for sharing. I wanted to ask you a little bit more about time management. So being in school, going back, how was that for you? How did you manage classes and clinicals and just everyday life?
Oh man, it was hectic. It was like drinking through a fire hose, honestly. Yeah. Accelerated nursing school is intense, and you all don't know it by now. You'll know it soon.
Sure. Learning.
Yeah. It comes at you quick, but it also finishes quick. But if you can kind of stay afloat and maintain that communication with your peers, with your professors, with yourself, that's a big thing, is being honest with yourself, and knowing your limitations, being able to ask for help when you need it. I think that plays a big part in success in school.
So what was the biggest challenge you faced as a new nurse in the CVPCU, or a new nurse in general?
So I started in the CVPCU, so the cardiovascular surgical intensive care unit. And the workload, it was a lot, but your patients, especially at MedStar, they're really, really sick. And that is not a time to make any mistakes. That's not a time to be tired. If your outside life is not in order, you're going to come to work and things can go wrong. And thankfully, I was able to recognize that up front, because I did have a lot of life things going on. I've got kids, I'm married, I just finished school.
You went straight through.
I went straight through and I didn't give myself any rest between that, and I think that played a part in why I burned out. I burned out quick. I think I was 4 months in when I was like, yeah, this is not gonna work. And so that being, again, communicating with yourself, being real with yourself, played a part in that. But yeah, I mean, I think that, if anything, not a mistake, but my biggest learning experience was not taking the intensity of the ICU as seriously as I should have.
And we appreciate your transparency as well with us. You share a patient experience that really impacted you.
Ooh.
I feel like you have so many.
I've got a lot.
Share as many as you would like.
So most recently, I had a patient. He went in for a coronary artery bypass graft. He had 4 of them done. So open chested. They had to rejig some things, take a vein from his leg to put it and use it in the heart.
That's so cool, actually.
Yeah, I know. It sounds so cool. Yeah. So he was, I think he was on like post-op day like 10 or something. He was well outside of it. Well, maybe like 7 or 8. But he bradyed down to like the 30s and 20s and then went asystolic. Wow. So obviously we had to call a code, but it's not just any normal code. It was we call it a cardiac code yellow, meaning that he's within the 10 days of post-op, and we have to crack his chest back open. So we had to do that. He recovered from that, came back to us 2 days later, back on the PCU, and he was doing fine. He was, he's a little anxious, so everything, obviously he basically died, and had to be resuscitated. And unfortunately, the same event happened where he braided again, and they had to call another code yellow. Luckily, we weren't able to find his pulses palpably, but we were able to find it with a Doppler. So we didn't have to crack his chest open again.
Yeah.
But the first time they had to crack his chest open, watching manual compressions is something I will never get out of my head. Watching another human adult putting their hands in the chest of another human adult and having to physically pump the heart for the heart to do its thing, that stuck with me, and that's gonna stick with me. And so that just goes to show, like, taking your patient assessments seriously, because that's something that could have easily been missed, because he was fine.
Yeah.
He was perfectly fine. And going from perfectly fine walkie-talkie to asystolic, where he's not breathing, he's not there, his heart is not beating, he's not perfusing quickly, that
can stick with you.
That sticks with you, and that makes a difference in how you care for your patients.
Yes. So how do you deal with situations like that? You go home and decompress. Like, how is it overall, your experience?
Cry in the closet, cry in the bathroom.
That's real. Crying is very therapeutic.
Yeah, it is very therapeutic. But talking to your peers, talking to your management, your resource nurse, anybody who's willing to listen, but don't hold it in. When I was in the ICU, I had, death happens. And I held one of them in, a patient that I was taking care of, and it weighed on me. And until I got to talk it out and kind of find what it was that I was feeling, I realized that it was normal after I did that. So I just being real with yourself and your emotions, that's really, honestly, your day-to-day, even if it's not death related or code related or anything, just the stress of being a new nurse, having somebody to talk to, preferably somebody who understands what you're going through. But whatever you got to do to get it out.
We appreciate you for sharing. How did you build confidence and clinical judgment as a new grad?
I don't think I'm fully confident yet.
You're a great nurse, but I feel it.
But no, I think the fear, just having that underlying fear all the time, understanding that it's okay to be afraid, or and if you don't know something, ask. That vulnerability, I think, is kind of what keeps me going, and keeps me on my toes, because I don't know everything. I'm not gonna know everything. Nobody does.
Literally.
And
there's
I think
always room for growth.
There's always room for growth. If you're not open to growth, I don't think you will do very well as a nurse, honestly. But yeah, I think just staying vulnerable, that has really built my confidence, because it's like, okay, I know this has happened. My experiences, this has happened before. I know I've done this in the past. Can this work again? Is there anything that won't let this work again? And asking those questions all the time, I think that curiosity is what builds my confidence.
I agree. Thank you. So what should nurses focus on, or current nursing students focus on now, if they're interested in the CVPCU?
Patient assessments, as tedious as they are, what you learn in, I think it was AG1 lab,
we have foundations lab,
all of that, where your assessment is your bread and butter. If you don't have a good assessment, you're not a good nurse, because something's going to happen to your patient if you don't know what's going on with your patient. That goes for PCU, that goes for peds, that goes for ED, that anywhere, ICU. If you don't have a good foundation, that patient assessment is your foundation. If you don't have that, you don't have anything. And that, I think, that's what makes you being able to recognize the abnormals. And because that's what's going to go wrong. And if you don't know that,
I would say Dr. Shanley, shout out to her. She really does make sure we know about the abnormalities, and Dr. R for patients, especially in health assessment as well.
To my face.
Yes. So, what advice would you give nursing students to be successful during clinicals?
Can ask questions. Ask questions. Get in there. Do, like, if something is happening, if there's a code overhead and it's on your unit, if there's even if it's just like some situation that's out of the norm,
For sure.
go look, go learn, know all the things, because the more exposure you have, the better your experience is. I was the person who was so nosy that I went into every single code on the floor, and
It's so exciting
it's
to be
so
able to be that firsthand and
exciting.
get that experience and exposure to patients.
For
So,
sure.
yeah.
And so I think if anything, it's go see all the things, go do all the things, get your hands on it, so you can say you did it. Because when it comes to time, when it's time for you to interview for your job, you can say, "Oh, I had these experiences," and you can talk them through it. You can walk them through it. You can, let them know, like, yeah, I'm interested. Because when it comes time, they're gonna want to know, like, hey, what do you know? What have you seen? What have you done? And that makes a big difference in, the job, you getting the job in that.
I agree. Thank you. What mistakes should new grads try to avoid in their first year?
Holding back. Don't hold back. Don't try to shy away from doing the things. Don't try to avoid the hard patients. Go get dirty. Like,
Sure.
go in there, do the thing, because that's what's going to make you a better nurse. Is because, you know what, I've seen this, I've done it, I know this, and doing it over and over again, it makes you a damn good nurse.
Very good, very good. And if you could give one advice to your past self as a nursing student, what would it be and why?
Take a break. Go take a nap.
For sure.
It's self-care. And I thought I was doing self-care, and I wasn't. And I wasn't doing enough of it. And I wish I would have done more. I remember AG1, our second exam. I bombed it. When I tell you bombed, I did not return to class after that and went to go get a massage.
I feel like we all need those moments.
Yeah.
Like, we're going to hit bumps in the road, but you persevering, that shows your resilience to keep going, that you'll be a great nurse, that you'll go through stuff and keep getting back up.
Oh, yeah. Yeah. I mean, it happens. Full transparency. Not taking my NCLEX seriously. My first NCLEX, I failed it because I didn't study. I was like, oh, I got this. My GPA is high. I was a good student. Like, I did very well in school. And so I'm like, oh, I don't have to study that much. I may have looked at like a couple YouTube videos, but I didn't take them seriously. And that was a mistake that I, now in hindsight's 2020, right? But for something so simple, something that I worked so hard for during school, for me to kind of like, not throw it all away, but kind of, not take it as seriously as I should have. I'm like, yeah, that was, it just, why not finish it out? Like, just complete the chapter. And the second time around when I took it, it literally was just how I answered the questions that made the difference. And it was just, doing that little bit of research to know how to answer the questions. And yeah, second time around, first time I failed I failed at 150. Second time I passed at 85.
Look at God. I love that for you.
And it's like but when you look at it after the fact, it's like, well, why didn't you just do that the first time?
It's okay.
But yeah, no, it's a learning lesson, especially, and it humbles you. It humbles you. Because I'm like, I'm no idiot. I'm no spring chicken, but I'm not an idiot. But it's like, yeah, just not taking that for granted. And I think if any mistake I made, that was the biggest. And that was right outside of nursing school. So yeah.
Got you. So what resources did you use to help you prepare well for the NCLEX?
So a couple of them. So I used NCLEX Bootcamp, which had a question bank. I paid for it. It is a paid service. It had a question bank. It had like quizzes that you could take, and it kind of tells you your progression. So that was really helpful in like getting used to answering the questions. I think you do 100 questions at a time. So it kind of gets you used to just sitting there and answering the questions straight through. I also used on YouTube NCLEX Crusade International. He goes over, he has like a 7-day training or whatever that went over how to answer the questions. The way that the questions are asked seem very intuitive, but it's the way that you answer the questions, and how to notice like what they're truly asking you, the underlying question that they're asking you. So those two are what I use to prep the second time. The first time, simple nursing, but not really taking it seriously. I kind of use simple nursing the way that I did in nursing school, and that is not going to be beneficial for you when when it's time for you to take the NCLEX.
So what's something about CVPCU that most students don't realize until they work there?
Your patients are still pretty sick. When people think step down, they think med surge, like med surge. CVPCU, like I said, your patients are within that 10-day window of having their chest opened. And things can happen, like my patient, where we may need to crack the chest back open. And so being able to keep that awareness that your patient is still, even though they may seem stable, they can decline rapidly. And so just keeping that in the back of your head, that goes back to that like fear, like that underlying fear. And as long as you maintain that, I think you're good. But yeah, it's something that people miss when they think med surge. Med surge, the surgical part, they just had surgery. So infections, that's a huge one. And having to go back in, redoing a surgery or doing another surgery, those things are things that people don't always think of. So yeah, I think if anything, that's something that people don't really keep in the forefront when they think CVPCU.
Okay. And how do you prioritize tasks when you have multiple high acuity patients?
Who's my sickest patient? And making sure that they are stable enough for me to go to the next patient, which in my case usually is like either the next sickest, or if like my other 3 patients are relatively stable, who's going to be the easiest? Who's the independent one? Who can I just get out the way quickly? Basically, who has the least amount of abnormals. So that's something that if you get a good report from the nurse before you, you'll be able to identify that when you're doing your bedside shift report. I think that also is something that's very important, is being at the bedside when you do your report. If you're sitting at a nurse's station trying to do your report, you don't have eyes on that patient. You don't really know your patient well enough to be like, okay, I feel like they're stable. They sound good. If you lay eyes on them and you're hearing their story, and you can do like a mini assessment while you're standing there, then you can help prioritize who you're going to see first.
Gotcha. Thank you. And do you see yourself staying in the CVPCU long term, or do you have other goals in nursing?
My long term and other people's long term are very different. The military has made it that way for me, but for now, yes, I see myself on the CVPCU. I like it there. I do. What do I want to do when I grow up? Maybe leadership, management, but step by step, next is resource nurse. So that right now, that's my short-term goal. And especially on my unit, people become resource pretty fast as long as you know what you're doing. I've already heard it multiple times that I'm in the process. I'm like next in line to become resource. And
I can see that.
I'm like, yo, I just got here.
Need some time.
But yeah, no, I think for the longest it was going to be like a CRNA
Mhm.
or a NP or something like
Mhm.
that, but I still don't know.
Yeah.
But I know for sure that I'm really good at leading. I'm really good at being in charge of some things, and being able to make changes that are beneficial to masses.
Yeah.
So I think that's somewhere in my future. But I'm a Libra, so I'm
I
indecisive,
love
and
it. Same, honestly.
I don't know. Things may
The sky's the
change.
limit
The
with
sky's the
nursing.
limit.
Gives you flexibility, so that's
Yeah,
good. Yeah.
yeah.
How do you continue to grow professionally as a nurse?
Staying curious. Trying to get the hard patients. Making sure that I perfect my foundation, my craft, my patient assessment. I've gotten it down to 5 minutes.
I love it. Very good.
Yeah,
Very
and
good.
that's a big
I
deal
agree.
because when you have 5 patients, you want to get in and get out, but still give the same patient
Of
care.
course.
But being able to be in and out of the patient's room while meeting all their needs within like 15 minutes. That's always the goal. Because you still got a whole lot of stuff that you have to do, orders you have to read, meds you have to pass to other patients. For us, walking our patients, so time management, getting in and out, being able to still meet the patient's needs while still meeting your own needs. That plays a big part. Yeah.
So I just want to ask you, is there anything you would like to share, just in general, to our nursing students, just to help them along the way, to keep them motivated, and just overall anything you would like to share with them?
Yeah. Don't give up. Keep going. It's gonna suck, but embrace the suck. Know that this is very temporary. It'll be over before you know it. And I know that sounds really cliche.
It really feels like time's going by so fast.
But time flies because what is this? 2026. I started school in January 2024. So that 2 years ago, and I feel like I was just here. I was just walking in the hall looking at our cohort
Yes, I see your
photograph.
picture.
I know, and like my face has changed much. I lost a little bit of weight. I was stressed.
It's okay. It's okay.
But like just seeing all my classmates and remembering all our times walking through the hall, but that it will go by so quickly and it'll be over before you know it, and you'll be given patient care and reading orders and not doing care plans. Um, in no time. But yeah, just keep pushing. Keep pushing.
I really appreciate you for taking the time. I know that our students this was really beneficial overall. And I just wish you the best moving forward. Thank you again.
Thank you.
Yeah.
You all. Good luck, everybody.
Thank you.